Good day, everyone. My name is Jovi Satoheto, caregiver of Sasin Iloilo. And today I will be performing nasotracheal suctioning. Is a special techniques that use the nasal cavity as a route for the insertion of a suctioning catheter into the trachea through the larynx. Nasopharyngeal suctioning removes the secretions from the nasal cavity, pharynx, and the throat by inserting a flexible, soft suction catheter through nares. Nasopharyngeal suctioning may be considered in a children with respiratory distress caused by upper airway secretions. Differences between nasopharyngeal and nasotracheal suctioning. The most important distinction between nasopharyngeal and nasotracheal suctioning is that the nasotracheal suctioning is more the differences between nasopharyngeal and nasotracheal suctioning. The most important distinction between nasopharyngeal and nasotracheal is that nasotracheal suctioning is more invasive. This means that the latter requires a longer catheter and more precision. Before performing nasopharyngeal suctioning, make sure the patient has no contraindication to the procedure such as bleeding disorder, apagotidus, nor ringospasm. I will lock the door, fix the curtains for the patient's privacy, and don't forget to perform hand hygiene to prevent infections and microorganisms. So gather all supplies. So here are the equipments. Suction catheter, suction machine or wall suction device, suction canister, connecting tubing, pulse oximeter, stethoscope, PPE, mask, face shield, non-sterile gloves for suctioning with sterile suction catheter, disposable paper drip, disposable cup, and tap water lubricant gel. And I will introduce myself to my patient, verify using two identifiers. Hello, ma'am. Good morning. I'm Jovi Satoheto, your healthcare provider for today. May I see your wristband, please? You can tell me your full name, ma'am, your birthday. Okay, thank you. So today, ma'am, I will going to suction your nasopharyngeal, which means I will going to suction your nose into your lungs to get out all secretions and to remove mucus and saliva from the back of your throat. Okay. Adjust the bed to the comfortable working height and lower the side rail closer to you. So position the patient. If conscious, place the patient in a semi-Fowler's position. If unconscious, place the patient in the lateral position facing you. Move the bedside table close to your work area and raise it to waist high. Place the towel or waterproof pad across the patient's chest. Then, place the pulse oximeter on the patient's finger and left the device in place. Prepare your equipment by connecting one end of the tubing on the suction machine. Turn the suction device on and set the pressure to the lowest level possible, then will effectively clear secretions. So after checking the pressure by blocking the end of the tubing, Place the open-ended tube near the patient within easy reach of your work area. Fill the tray compartment about 100 millimeters of sterile normal saline solution or sterile water. Squeeze the lubricant gel on the open sterile catheter package. Be careful not to touch the package. Depending on your agency policy, you now apply either a pair of sterile gloves on your dominant hand and the clean gloves on your dominant hand. So use your dominant hand to pick up the suction without touching any non-sterile surface, and use your dominant hand to pick up the connecting tubing. Attach the catheter tubing to pick up the connecting Attach the catheter tubing to make sure the equipment works properly. Suction a small amount normal saline from the basin. Increase the patient's prescribed oxygen fluoride and instructing her to breathe slowly and deeply, likely 6 to 8 centimeter or 2.4 inches and 3.2 inches of the distal end of the catheter with the water lubricant gel. Okay, Mama Marisol, I'm going to suction your nose into your lungs to get all secretions. Use your non-dominant hand to remove oxygen delivery device as the patient. Inhale deeply. Use your dominant thumb and for the finger to insert the catheter gently but quickly into one of the nearest as she inhales. As you insert the catheter, do not cover the catheter vent. Follow natural course of the near orient the catheter downwards slightly. Don't force it. If you feel resistant, you will probably hit the carina. In that case, withdraw the catheter 1 to 2 cm between 10.4 and 0.8 inches before applying suction. When you are performing nasopharyngeal suctioning, a good general route is to insert the catheter to roughly the same tab as the distance from the mouth or tape of the nose to the angle of the mandible. In adults is about 16 cm to 6.4 inches. In older children, 8 to 12 cm, 3 to 5 inches. In an infant and young children, 4 to 7.5 cm, 1.6 to 3 inches. If you're performing nasotracheal suctioning, insert the catheter about 20 cm, 8 inches in adult, 16 to 20 cm, 6 to 8 inches in older children, and 8 to 14 cm, 3 to 5.5 inches. In an infant and young children, and some in traces, turning the patient head can help you to suction more effective. Turning it to right will help you reach the left mainstem bronchus, and turning it to the left, you reach the right mainstream bronchus. Apply alternate or continuous suction by placing your non-dominant thumb over the bend of the catheter for 15 seconds. At the same time, withdraw the catheter as you roll it back and forth between your dominant thumb and fourth finger. Then encourage the patient to cough. Ma'am, can you cough for me? Place her oxygen device and instruct her to inhale deeply. Assess to repeat the suctioning procedure. Rinse the catheter, then the connect and tubing by suctioning normal selling the catheter and have cleared the secretions. So, when you finish the suctioning, detach the suction catheter. Remove the gloves. Gather all supplies to the receptacle. So, don't forget to wash your hands. And for the documentation, I will document the procedure and related assessment, finding, report, and any concerns according to agency policy.